KVU's Ellie Nakamoto-White is here. Ellie, the big question on many people's minds has been, how is this going to impact our hospitals? What have you learned today?
Alyssa, state health officials say their biggest goal with the mandate is to protect their patients, families, and employees. But some say because they're stretched from a staffing standpoint, that any impact within Washington could have a ripple effect across the state.
We know these vaccines are safe and effective.
Health leaders across the state coming together Monday morning as Washington's vaccination deadline hits.
Our state is so interconnected with respect to the healthcare system that any loss impacts all of us.
Officials say staffing is one of the biggest mandate worries.
It's both a goal to hire more staff, but also to figure out how do you reconfigure services in a way that you can cover with the staff that you've got.
All of those that are patients, many of them are immune compromised, and we really feel strongly that we have to protect our patients, our families.
We've also, from the mandate standpoint, had many staff who are actually pleased that we are creating an environment that is safe for them.
Here in Tri-Cities, Cadlick says they had 95.7% of their workforce comply with either getting vaccinated or receiving an exemption. The remaining caregivers who did not submit proof of vaccination or submit an exemption request were placed on leave, and we're working with each individual to help them come into compliance.
Our workforce in healthcare, in order to protect the patients that we're serving in here as well as themselves, should get vaccinated.
Cadlick officials say their operations should not be affected by the mandate, but even if they are, they do have contingency plans in place. Now, a recent study from Washington State University shows some people are not changing their minds about getting the vaccine. The study surveyed 800 people nationwide each month between February and May 2021. Around 1/3 of the study participants are not willing to get vaccinated. So I spoke with the study's lead author, who says officials should focus less on generalized messages and more on identifying the specific causes of vaccine hesitancy.
We are using the same message for everyone. And same message for everyone is not going to work, because if you have a significantly different concern than I do, then the message that will work for me is not going to work for you.
He says figuring out why some are refusing to get vaccinated is the key to making messages targeted for those specific reasons.
Now, going back to hospitals for a minute, Ellie, do we know specific numbers as to how many people they're thinking they're going to lose tomorrow?
Yeah, so officials with the State Hospitals Association say they're expecting to lose between 2 to 5% of their employees. But again, we're not going to know those official numbers until early November.
All right, thank you.